Well, I want to thank everyone who is joining us today. We're really excited to have you. And just so everybody knows, this is going to be recorded. So if you know somebody who missed it and wants to revisit, please let them know. So I'm Leanne West, and I am Chief Engineer of Pediatric Technology at Georgia Tech, and I'm also the President of the International Children's Advisory Network. And today for our Tech Talk, we have Jennifer Singh joining us to talk about mapping autism service inequalities through interdisciplinary research. And Jennifer, I'm going to let you introduce yourself.
Sure. Well, first of all, thank you for inviting me to this Pediatric Tech Talk. I'm excited to share my research with all of you. There's a lot of different nodes going on right now. My name's Jennifer Singh. I'm an associate professor in the School of History and Sociology at Georgia Tech. And my research area has been in autism. And more recently, more like the social and cultural understanding of autism. More recently, I've been focusing on health inequalities. And so I've been doing this work for over 18 years, and I have a couple of different projects that I'd like to share with you. My training is in sociology. I have a background PhD in sociology with a focus on medicine, health, science, and technology, but my training is also interdisciplinary. So I have a master's in public health, and I got a biology degree as an undergrad. So I kind of take in all of this training and knowledge in the research that I do.
Very cool. So how did you get involved with autism specifically?
Right. So about 18 years ago, when I was getting my PhD living in San Francisco, I needed a job. So I was able to secure a research project with the Stanford Center for Biomedical Ethics. And they had just started a new research grant that was looking at the ethics of genetics research on neurological difference. And autism was our case study. And so that was my first interdisciplinary group where we really started trying to understand why, at the time, autism, the prevalence was low, but was rising. And there was a big boost in research, especially around genetics. And so this was the initial project that brought me to start investigating autism that eventually turned into my dissertation that has turned into almost 20 years of research. And then there's always, I think maybe some folks, even on the call, there's always a personal connection. And so for me, there was a personal connection as well.
Yes, I think that's true a lot in healthcare. So what were some of the main findings of that early research?
So I was able to investigate, so I was really interested in understanding the impacts of genetics research on autism in terms of the way in which people were experiencing it and how they were actually using the knowledge. So I interviewed scientists who were in the field doing this research, creating consortiums and databases. I interviewed families who participated in genetics research. I interviewed people. So I started my research really trying to understand autism from the perspective of someone who's actually experiencing it, because as a sociologist, we understand or try to really think about how different entities can construct and create ways of thinking about difference, right? And so parent advocates were a big part of my story in terms of thinking about their involvement in the rise of autism, but with a very specific focus in mind. I mean, it was cure autism now, right? Which is no longer exist. And so I chart that history and in the way in which the focus really was on genetics. At the time, there is no gene for autism, but when we think about it, there is no one autism, which oftentimes is needed to identify a particular gene for a particular condition. It's a very complex human condition. One of the things that I did find, though, was by focusing on the genetics and the biological components of autism, it obscured a lot of the social and the cultural ways in which people understand and experience it, which, as much as I would ask families about their, what do you think about participating? What about this genetic knowledge? They kept coming back to me about, well, let me tell you really what's on my mind. It's about getting my individual education plan. It's about getting access to behavioral therapy or lack of. I mean, it always, how am my son's transitioning to getting kicked out of high school at 20. And so now what are we going to do? These are the stories that kept coming back, which is sort of what led me to the work on inequalities.
Yeah, very interesting. And so in thinking about this, and I know your research a little bit, I know you've created kind of an autism services map to help those people that you were just talking about.
Right. And so this research was really inspired by inequalities research that I did at the Autism Clinic, which is where I'm actually at right now. I had the opportunity to interview over 70 families who visit Hughes Spalding Autism Clinic downtown. And so these families mainly rely on Medicaid health insurance, have very limited resources. And what I kept hearing over and over again through my observations and interviews was just that I'm unable to access the services that were referred to me. It's too far away. I rely on public transportation. I need something in the evening because I work all the time. So there was all these barriers that were really limiting what people could gain, or get access to for their children. And, it's even particularly more challenging if you have more than one child with a disability. And so through another collaboration with the Digital Integrative Liberal Arts Center, so it's a center at Georgia Tech, they gave me a small bit of funding to develop an sort of an interactive map that would not only allow us to identify services geographically, because one of the things I did is I took the referral lists and just started mapping them out on a Google, map that I printed out, and I would just literally start mapping it, and you could see the distribution of resources were unequal. So most of the services are available in the north and very, very few in the south, just like I-20 was just kind of the dividing line. And so I worked with another grad student who was brilliant, city and regional planning, and she knew computer programming, who helped me create this vision. And if you want, I could share that with you.
I think that visual would be great.
Let me see. Bear with me. So can you all see my screen?
Yes.
So this is just a screenshot of the map, and it's available if you want to take a look at it and interact with it yourself. But what I'm going to do is just kind of take you there. And so this is our website, and we did a couple of data visualizations as well. One of them, which is called the services cliff, that adults experience once they age out of high school. And so here is just a map of Georgia, and we have a provider search. And what we can do is say I wanted to identify, someone who's between 6 and 11 years old. So the provider provides services for 6 to 11-year-old. I'll just say we'll select all operating hours. Payment options, like I said, many of my families rely on Medicaid. And then we also have an accessibility requirements. And then we have a whole list of services that we can start searching for. And I've already gotten a really great feedback from families telling me, your map really helped me identify the source that I needed. I was going crazy looking for, in this case, occupational therapy. And so what's nice about this is that you can, and we just used it right now in the clinic. We had a parent who lived in Fairburn. And so I gave her the two, there was actually 2 resources available in Peachtree City. But you could see, one of the things I was interested in is just to see the distribution of resources that are available for families, in this case, occupational therapy, and how they're unequal across, the map. And then, if we want, we make a list, print it out, give it to the families so that they can follow up on their own. Another feature, because I'm a sociologist, I'm interested in structural determinants of health. We took the CDC Vulnerability Index, which is an index that looks at various different factors that are generated from the census, whether people speak English less than well, whether they're in multifamily households, whether they live in mobile homes, whether they're, there's a certain level of unemployment and the like. So the overall series shows that, let's see, I can't see, I'm seeing you all here. The darker the color, the more vulnerability. And so one of the ways, and these are by county. So if we look at what we just looked at in terms of the data, we can start looking at the map as it relates to vulnerability versus the number of services that are available. And so one of the future projects is to work with an educational specialist to really develop a module that could be used in, for training students and things like that. So that's one of the cool projects that we're working on right now. I have some funding to really work on the back end to make it much easier to add data. Currently, the data we use is provided by Parent to Parent of Georgia, which is a parental advocacy group, and they gave us a list of resources that they've vetted that are specific to autism. So there's a lot of work to do here, but this is the prototype that we developed.
Well,
which was informed by talking to 70 families and observing, what were the issues here.
Yeah, so I love that you've worked with families, but also, different organizations around the state. So I think it's great that you're really collaborative like that. Can you tell me a little bit about how that working group started and maybe some of the players in the working group that you work with?
Sure, yeah. So after maybe about 2 or 3 years, when I guess about maybe 2 years, I think it was in 2018, I started the research in the clinic in 2016. We just got around together. We had a lunch, back in the days when we could get together and have lunch, and just really wanted to, I wanted to share with folks what I had learned in the clinic. And so I think we had a couple of folks from Marcus, Dr. Rubin and I, and we just started talking about how we needed to start building a community of researchers who were interested in autism disparities to identify the needs and then work collaboratively towards resolving some of these major problems that people are experiencing. And that's really how it started. We initially just had to identify who are we and what do we want to do. We developed, a mission statement, a website, and some of the particular mission was just really to address and bring attention to promoting equity in autism and work towards sustainable solutions, working with communities in terms of identifying what the issues are, develop relevant research questions, certainly expand interdisciplinary research, and then disseminate information and resources. And so from that small group of 4, we're up to, maybe 15 folks. Certainly the pandemic kind of stymied our interaction, but we were still able to sustain it. And during that time, even before the pandemic, we had started a paper to really start thinking about different levels of racism and how it has impacted the many differences we see in diagnosis and early intervention and access to other kinds of services, even the way in which we view and think what autism looks like, right? Typically, if you look at Netflix, there's all sorts of things now. I mean, it's so interesting to be in this field for 18 years and just see how it's changed so much. And I definitely see the voice of autistic people as part of the process, and that wasn't the case before. But what is lacking still is the understanding and awareness of how autism really affects all communities, but in very different ways. And so this model, we're hoping that it can really inspire new ways of thinking about the science. So when I looked at the research, so when I looked at my N of 70 of who I interviewed for the evaluation of this project here in the clinic, and I looked, and we use measures of quality of care that were part of the National Center for Children with Special Healthcare Needs. So we had national data and we had Georgia level data, and our data is so much more diverse than the representation of what this national data sets. I mean, this sets policy, right? And so we want to make sure that there is that inclusion in science, because historically it has not been the case. When we think about cultural representation, we did sort of a review of television and movies to see who, if there's an autistic character, who do they look like? What do they look like? What kind of resources do they have? Because it's a very homogenous group, mostly male, mostly white, of mostly some level of resources. And so we're really pushing towards trying to think about how we can change that narrative. And so creating documentaries is sort of on our next list of things to do. I just wrote a grant to do that. So we want to develop community informed issues that exist in the Black community, whose children or who are experiencing autism, and have it led by people who are part of this community, but facilitate that process. And so that's what we're hoping to do in the next year.
Yeah, so one of the things you mentioned is the importance of including the patient and the family, and I completely agree with that. As president of the International Children's Advisory Work, that's exactly what we suggest that researchers and clinicians do, is be sure to include that really important voice. And I know just, the fact that you've included them and you've mentioned some different partners, that you have a really interdisciplinary research group helping you do all of these things. Yeah. And so what are maybe some of the key insights that you all have found?
Right. So I think one of the things I failed to mention, I'm just looking for the one slide that has like all the different group members. So we have expertise in care coordination, nursing, occupational therapy, pediatric psychology, social work, sociology, speech language pathology. So, and you can imagine that we all have a different way in which we're approaching the question, right? Or like the outcome. And so that's been a challenge. And then of course, within Georgia, we have, CHOA, Augusta University, Emory School of Nursing, Emory School of Medicine, Georgia State, Georgia Tech, Marcus, Morehouse School of Medicine. And so, and it keeps expanding, and we're always inviting folks who really want to be part of the group, come on board. And the people who just keep showing up are the ones that are actually going to do the work. So I would say key insights is that you have to come to common ground. You have to be prepared to explain concepts, ideas, and really think about, oh, you're talking about this, well, I'm talking about this, and it actually means the same thing, but we're calling it something different. We are all in our own disciplines. We have our own lexicon, our own language, and sometimes they mean the same thing, right? And so, and I think identifying, people who are committed. I mean, I think we're all doing this work that is not part of our job. Right. So if there is a way we can do this work where it does become part of our job, I mean, so unfortunately, I think the realities is that we're compensated and we're rewarded for work within our disciplines. And there is a push towards interdisciplinary research, but how do we get rewarded for that in a very substantial way when it comes to like our careers, even the kinds of publications that we do and the kinds of materials that we produce. I think, healthcare in the 21st century is complex. We live in a very complex, the way in which people experience medicine and health, it's not, COVID is a classic example, right? In terms of thinking about, even though we know about the virus and the science of the virus, you really need to work with communities. You need to have interdisciplinary approaches that understand how we can, understand the social. And so more and more I see, because I've been doing this work, because my training is interdisciplinary and the projects that I've shared with you have all been interdisciplinary, the synergy and ideas are so much better than they would be if I was just doing it alone. How boring would that be as well? And maybe that's just part of my, working in industry for so long. There was a lot of collaboration and there was spaces made for people to come together. And I think even structurally in the spaces where we work, we can even have more important places that are really designated to interdisciplinary thinking and making and doing,
Yeah, I think interdisciplinary in your teams that do research is really important, because with everybody coming at it from a different perspective, they're going to think about it a little bit differently, and they're going to have different ideas about how to solve problems or what needs to be looked at. So 100% I agree that interdisciplinary research is really, really important.
Yeah, I mean, just even like most things, you hear a call for research or for a grant and it's due next week. And so I called on the working group and I said, let's talk about an idea for this documentary. And so one of my colleagues at Emory, she's like, well, I did research where we're thinking about, inclusion. Maybe Zoom or person-to-person interviews is not the best way to go with folks who are autistic. They might want other alternatives. So I created this platform for other alternatives where they can actually, provide feedback through their computer, right? And so, I mean, it's just those little nuanced things. It's like, oh, that's a great idea. We're not reinventing the wheel. We're just bringing it all together.
Yeah, absolutely. So what are some key insights that the group has thought about or found since you started it?
Key insights. Well, I mean, our model has been really useful. So this model of structural racism, and the thing is that, again, some folks who are coming to the table are like, I hadn't really thought about this before, right? I hadn't really thought about that, the way in which our society is structured historically shapes where these resources are located, right? Shapes, how public transportation is funneled through the city and not outside of the city. And so I think the other thing is that we can draw on our own expertise and resources, right? When we really need something to come together. That takes time. Those relationships take time as well. And so you have to really be committed to this kind of work. And I don't know if I'm answering your question, Leanne, but I think the key insight is, at least for me, and I hope for our working group as well, is that when we're looking at differences that we experience, that the quantitative data shows that there's a lot of differences based on diagnosis, the timing in which kids get diagnosed based on race, ethnicity, social class, even gender. Even though the prevalence has sort of leveled off when it comes to race, ethnicity, not gender, but the differences still exist in terms of representation in special educational services, in terms of having transitional plans when you become an adult. So there's so many other processes where we're seeing those differences. And so we can count those differences all day, but until we understand the root cause of what's causing those differences, how do we create interventions that work? And so I think that's been a key insight in terms of creating a model where we're looking, it's the science, it's the public policy, the social structure. We specifically look at and think about residential segregation because public education is a very key component to services for many families, and it's not equal depending on where you live. And then, of course, the cultural representation. All of these are working together to really shape the different outcomes that we see.
Very cool. So we have just a few minutes left, and so I want to see if there are any questions from the audience. And you can raise your hand. Yep, Sarah, go ahead.
Hi, Sarah.
We'll be, I guess, sort of meeting again tomorrow at a call, but what I wanted to ask was, I know it sounds like a lot of your work was finding resources in the community for these populations, but what I'm also wondering is, what does this care and equity look like when you are in the facility? Because I think there's still gaps, even when you have the care, that you're not getting all the resources you need even when you're here. And whether it's conscious or subconscious, how do you ensure that you're getting that?
Right. Right. And so that was really part of our survey. We did a quality of care survey. And what we found was the measures for family-centered care were very high. Listening, spending time, feeling like a partner with your provider. One of the things that was limited was having multilingual frequently asked questions. So at the clinic there, and this is true for lots of different, clinics here at CHOA, you're meeting with multiple providers, speech language pathologists, a nurse practitioner, developmental pediatrician, occupational therapist. Those names and what those professions and what those people do may not make any sense to you, right? And so really having specific things, this is what this person will do, and these are the kinds of questions that they're going to ask. Another thing that we found in terms of areas for improvement was just really streamlining the questioning. Because you have all these different providers coming in, parents constantly said, I felt like I was repeating myself. So is there a way we can streamline that better so parents don't feel like they're constantly repeating themselves? And then the other part was at one point they did have a family support specialist. There was like small funding for a family support specialist. So this was a family member who had training and was bilingual, who could then work with families who had a new diagnosis about some of the key community-based resources. And so, there's so, in one day, 20 patients are seen. That's a lot. And may even be 5 new patients where it's a long, you have to learn about the families. And so, and that was another area of thinking about improvement is, as an observer in the clinic, we moved 3 times because there was a lot of construction in the building. And so then they had this final, beautiful place. And it is beautiful, but the rooms are set, they're designed for one person. Mm-hmm. And this is a pediatric hospital. Mm-hmm. And so the rooms are small. I mean, when we first went in, we were super excited. It was like, oh my gosh, there's no room for grandma, mom, dad, sister, and the kid. Then the developmental pediatrician, nurse, and so it's like, and I asked, was anyone consulted about the size of the room and what the best space would look like for these interactions? And so, and that there's just, to me, it's like, okay. And even on the door, it said no more than 3 people could be in the room, but it's like, this is a pediatric clinic, Yeah. That's ridiculous. Kids aren't going to be in there by themselves. So it's like things like that. And that where I think we can learn from these kinds of observations and studies.
Yeah, I think physical space is very sometimes forgotten in not just the room size, but signage, access, even like we have a lot of things on an app or a web page, mm-hmm. Language access on those platforms as well. So it mm-hmm. can't always be another human being there to help navigate through those moments.
Right. Right.
And so we're at the end of our time. We will stay on a little bit longer to catch more questions, but I want to say join us September 21st for our next Tech Talk with Pinar Kiskanokak, and she's going to be talking about operations research and health and humanitarian applications. But we can go right into the next question because Hong Chen, I see your hand is up.
Yeah. Thanks to y'all for coming.
Yeah, actually, Jennifer has already addressed some of the questions. I'm curious about the autism inequity in the clinic, which is about language barriers. Mm-hmm. It's about the access to the translation services as well as this multilingual, medical translators, all of this, which is sort of part of my research discipline about linguistics. Mm-hmm. Yeah.
Well, originally, so the Pediatric Research Center was the funder for the collaboration I did here at Children's Healthcare of Atlanta. And so that really that was a springboard to everything I've shared with you today. So thank you. The original grant was designed to interview Spanish-speaking families as well. I am not fluent in Spanish, not enough to recruit. I was going to hire an interviewer, but the establishing rapport, recruiting a family takes a lot of skill. And so if you don't have the language, then it's not going to happen. And the other thing that I was uncomfortable about was just the time. So if you're coming to the clinic for the first time, you're going to see 4 providers, you're going to be here all afternoon, right? Expect at least 3 hours or more. And so when you add the language barrier component on top of that, you add a couple more hours because there's one translator in the hospital, right, that speaks Spanish or some other language. And then, and if they are not available, then you might work, and it just happened today, right? The interface wasn't working. And so, what do you do? And so it's just more waiting and waiting. And so there's seriously problems in that process. And it's not very just to allow people who have a child who, you're in a small room, it's hard enough already, but then you add that component that makes the whole visit that much longer. And so I believe that in order to do this right, I need to work specifically with folks who are fluent in Spanish and could be part of the team that would do that research. And it takes it to, and it needs to happen, even though it takes more work, more money, more time. It definitely needs to happen. Otherwise, how do we go about addressing the unique needs? When I think about Spanish-speaking communities, I mean, maybe immigration, anti-immigration policies are of concern. Maybe there is a lot of stigma associated with having a child with difference and not wanting to call out that difference for concerns about immigration. So there's a lot more to think about with different families and their life situations. Any other questions? I'm happy to answer.
We might be good then with no more questions. I want to thank again everybody for today for coming and listening, and thank Jennifer for being here to talk about her research, which is very, very interesting.
Yes.
Yeah. So
great.
Again, join us September 21st. Thank you.
See you tomorrow, Sarah, or the next day.
Bye. See you then.
Bye-bye.
Thanks for your time, y'all. Have a good lunch.
All right.